tube through your urethra or your penis into your bladder. It will be a little uncomfortable, but we'll try and make it not painful as much as possible. Please let me know if if there is any pain. Just before we begin, sorry, is that okay with you? Ask their consent. Can I confirm your name and birthday? Okay. So, if the patient is able to undress themselves, allow them to do so. If not, assist them in undressing themselves. So, let me just prepare my materials first. And before you begin, to prepare your materials, make sure you have a syringe that is full. This is not enough, we need a bigger syringe. It should be 10. We'll use the bigger syringe. Usually you'll have a 10 milliliter syringe with you, but in this case we don't. So this won't work.
Okay. You wanna catch? You wanna catch the phone?
Okay. Pretend this is enough. It's 10 milliliters. We'll just pretend for now. But in a real patient, make sure that it is 10. I'll just demonstrate what happens outside of your patient. Is the bag at the end will expand. This is broken. So, unfortunately, I can't demonstrate what happens. But usually, the bag at the end of this syringe will expand, and this must have been used for a lot of demonstrations. It will expand so that it cannot be taken out and allow for the free passage of urine or other bodily fluids out of the body with use. So patients that often need this are those who cannot urinate by themselves. They have a problem with urinating. And we do that so that we can either collect fluid sterilely from the bladder or relieve the pressure from their bladder if it's overfilling. Okay, so usually, again, this is in a bag. We have the accompanying collection bag that accompanies the Foley catheter. This will be inserted into the hole that has no, the one that's not for the syringe. Okay. So again, so we ask permission. We will wash our hands, prepare the materials, wash our hands. Get gloves. An assistant will often open the bag for you. I'm very sorry. We have to prepare the patient first as well. So we would prepare the patient. This one is a male. We also have female here. Hermaphrodite. Where is our materials? So you'll have an antiseptic swab that you'll be able to use for the patient. So I don't really have gloves, so we'll just pretend that we're getting from the antiseptic swab. You will prep the patient. So what will happen, let me just try, let's do it with the girls first. So that looks more realistic. Usually these are sterile gloves. Okay? What will happen is that you'll prep the patient, or an assistant will help you prep. You will grab with your non-dominant hand the base of the penis and proceed to clean from the tip outward, okay? So you grab it, clean it, and clean from the tip and then downward to the rest of the area of the penis, area you're grabbing, so that it is sterile. The assistant will open the bag, and then you will grab your Foley catheter. Make sure, remember this is a sterile instrument again. You cover the tip again in jelly. So you would get the jelly and you begin to insert this into the urethra. This is very old. Usually it's much stiffer, so. Okay, I don't think it's going to go in because it's old. But you would insert this into the urethra and insert it all the way till the Y area, the Y junction of the urethra, all the way to the tip. We want to make sure that the end of it is in the bladder, because if we inflate the bag and it's still within the urethra of the patient, it will explode. Not the bag, but their urethra will explode. So when it's up to the tip, you will get your syringe, insert it into the inflating area of the shoot.
What?
Of the urethra. You would, what do you call it? You will flush the fluid into the bag and then remove it. And then you will withdraw the Foley catheter until you can no longer, until there's some resistance. And you will get one of the tapes and secure the catheter to the leg of the patient. Okay? And that would complete the and then you would attach the bag to the end of the tube and secure the bag. Usually there's some ties to the bed if there is. Okay? Does anyone have any questions? Okay. So if there are no questions, the same procedure is done for the female, except that when you are going to insert the catheter here, to clean it, you would spread the labia with your non-dominant hand with the fingers and clean from the from inside to out in a downward manner. So you would clean and then you would go around the area. Be sure to do it twice. And then you would begin again to insert the catheter into the urethral opening of the patient until, and the same procedure, up until the Y. So you would insert it until, say for example, that's inside. Try to make sure it's not going into their vaginal canal. Make sure it's into the urethra. You will be able to confirm that it's into the urethra if you see urine coming out into the bag afterwards. So, and then again, all the way up until the Y. Gosh, this is an old. Unfortunately, we can't demonstrate it properly with this dummy since it's really hard. Pretend it's all the way up into the Y. So you would again flush or put all the fluid into the bag, then withdraw it until there is resistance. attach it. Attach it to the leg, and make sure to attach the bag to the end of the Foley bag, the tube. Okay, so does anyone have any questions about this procedure? If not, I think you have another class at the moment. So you may come back here, I think, I'm not sure when, whenever the skills lab is open.